Hi, my name is Nubia Serino. This PowerPoint is for Psychology 4322, Cognitive Psychology. This PowerPoint is on Attention Deficit Hyperactivity Disorder known as ADHD. ADHD comes in three different features. There's the inattention, being hyperactivity, and of course the impulse part of ADHD. A little more into the ADHD features, inattention. So they have difficulties paying attention, challenges with focusing, concentration, and attention to detail. There's difficulty of staying organized. They might struggle with planning or prioritize or time management, and they avoid tasks depending on the focus or the ability to maintain focus to extended periods. It's very limited on their time. Those with ADHD also will be excessive movement. So they're always fidgeting, excessive talking, or they're just blurring out answers, or they feel restless, or they act without thinking. They're very impulsive. They interrupt others, speak over them, or their difficulties waiting for their turn. So on this slide here, we have a timeline of ADHD. It had been diagnosed back in the 1900s by a British pediatrician. As it comes into time, we do see that the FDA does approve of medication in 1936. This medication was actually used as a nasal congestion medication that was prescribed by Dr. Charles Bradley. One of the side effects was that there was an improvement on behavioral and school performance in children. However, at that time, Dr. Bradley didn't really follow up with this side effect of the medication. We move forward to the 1960s. In the 1960s, this was known as a hyperkinetic reaction of children. However, by 1968, the APA does recognize it as a mental disorder. So therefore, by 1955, we start seeing medication, which is Ritalin at that time, as a treatment for ADHD. By the 1980s, the APA does release a DSM-3, and here is where the name of hyperkinetic reaction of childhood gets actually renamed to attention deficit disorder with or without hyperactivity. So at that time, it wasn't considered as together. It was either with hyperactivity or without it. In the 1987, the APA does update, revises the DSM-3 once again, and it actually reclassifies the name. And at this point is where they name it attention deficit hyperactivity disorder, which is how we know it now by ADHD. In here, they do include symptoms as inattentiveness, impulsivity, and hyperactivity, which we reviewed on one of the past slides. We move forward into the 1990s and the 2000s. By now, of course, there is a little more awareness of ADHD, what it is. Parents are a little more educated in regards to it, and so is providers. Therefore, we have made an improvement when it comes to medication, treating the condition, as well as being able to diagnose ADHD. So on this next slide, this does present the statistics. I pulled these stats from the CDC, which was recently updated in 2024. But it does show, of course, that by 2022, there was a survey done by the parents, whose children have been diagnosed with ADHD, and it just shows that between the age 3 to 17, there has been about 7 million diagnoses. The CDC does report almost half of children with ADHD also display behaviors or conduct problems as a separate concern. And then based on one of the articles that I have attached as a source, they found previous studies where they do suggest a genetic component on the ADHD. This is either by the maternal pre-pregnancy obesity, overweight, smoking, or anything that they had been exposed like that through pregnancy. It can increase the risk of ADHD. On this slide as well, I went ahead and attach this chart to it. So the chart is broken down into age categories, and this is pretty much just conditions that are with ADHD. So it's not just ADHD itself, it comes with another mental disorder with it as well, and it's color coded. It has a little chart on the side. So based on the DSM-5 criteria, there is two types. So we have the ADHD inattentive type, which is what's on the screen. And in order to fit this DSM-5 criteria, at least 6 of the following symptoms or characteristics might be presented in the individual to meet this criteria. So some of the symptoms are difficulties with attention to detail, difficulties sustaining attention, difficulties listening when spoken, failed to finish tasks or follow through with instructions, difficulty organizing, difficulties with task requiring, and often loses things, often easily distracted, or often forgetful in daily activities. Now, out of that list of symptoms, at least 6 would be what you would pretty much need to have in order to be diagnosed with the ADHD inattentive type. However, symptoms are experienced in at least 2 settings. This can be either at work, at school, at home, or just socializing with others. These symptoms are considered affecting the ability to function academically, socially, and at home. And symptoms are not better explained by another psychiatric disorder. I will add that symptoms need to be experienced prior to the age of 12. So it is important on the age where these symptoms are being recognized because it does have to be prior to the age of 12. So this is the DSM-5 criteria for inattentive type. The next slide does have the DSM-5 criteria, but this is for hyperactivity and impulsive. Same thing, at least you need to have 6 of the following symptoms or characteristics to be presented in the individuals to meet the criteria of hyperactivity impulsive. Once again, you need to be within the age 12 and under. Symptoms also can be experienced in 2 settings, again, school, home, work, social life, and then symptoms, of course, are considered affecting the ability, again, academically, social, at work, at school. So for the hyperactivity impulsive under ADHD, the 6 or plus following symptoms, of course, are often fidgeting or, can't stay still. Often leaving the seat when remaining seated is expected. So in classrooms where they're supposed to be seated, the child gets up and wanders around. Often runs about or climbs when inappropriate or feels restless. It can even be like a jumping or just like moving your leg a lot. That would be part of the category as well. They feel restless. Difficulty playing or doing things quietly, such as like pencil tapping or just doing noises with their mouth or just tapping stuff. They appear to always be on the go, or as if it's driven by a motor. It's one of the examples here. They talk excessively and they often answer questions before they have been completed. They often have a difficulty waiting for their turn and often interrupt others. So they're pretty impulsive, a little hyper, jumping into answering without waiting for their turn. The next one is physiology of ADHD. So ADHD has a lot to do with the brain. This pretty much broke it down into broken down into a total of 3, but we have 2 on this slide. The first one, it is the neurotransmitter imbalance. So ADHD is related to lower levels of dopamine, which is chemicals in the brain, and that helps us to pay attention, feeling motivated, and controlling impulses. Dopamine is important for the brain pleasure and reward system. When the levels are off, it can be hard to stay motivated. It helps to pay attention and stay alert. Not having enough can make it hard to focus. Under the neurodevelopment disorder, ADHD, it is a neurodevelopmental disorder that originates during the brain development, leading to challenges in self-regulation and executive functioning. Next slide, we have the brain structure and the function. It says, again, physiology of ADHD. So people with ADHD often exhibit structural brain abnormalities, particularly in the frontal cortex, on the prefrontal, cortex, and the basal ganglia and cerebellum, characterized by smaller volumes. The brain imaging reveals decreased activity in the frontal crucial of the attention and executive function. And executive functions include planning, decision making, and impulse or controlled, impaired due to the prefrontal cortex being affected. I found this very interesting. The brain has a lot to do when it comes to decision making, as well as the impulse controlled. It's all the chemicals in the brain. So pretty much those with ADHD, if they were to do some type of scan or like the images will reveal, of course, the decrease on those with ADHD compared to a person who is not diagnosed with ADHD. So there's two different type of treatments that are available for those with ADHD. There is the stimulants, and the stimulants are mostly common and they're more effective when it comes to the treatment for ADHD. It does benefit about 70% of the people with ADHD. And now the stimulants do come in different types. So you have the immediate release, the extended release, and the long acting. Um, the Concerta is what's known as the long-acting. Adderall, it's more of an extended release. The side effects, however, in stimulants, it is a change in blood pressure. There is a decrease in sleep and a decrease in appetite. So it is important that when children are being treated for ADHD, it's hard for them at times to communicate. So it is important to just keep in mind to keep an eye on them, see how they're doing with the medication, or there's any changes on medication or dosage. It's very important, of course, to keep an eye on that. Another option on treatment, it is the non-stimulant, and these are pretty much used on patients who present of anxiety or they have difficulties tolerating this stimulant. Most of the non-stimulant are also antidepressants. It's a popular aspect to treat ADHD for those, again, who cannot tolerate it, the stimulant, or do suffer from anxiety. One of the medications is Wellbutrin. That is an antidepressant, but again, it can also treat ADHD and mood disorders. There's also the alpha agnostics, and these can be effective treatment for children who are younger compared to adults when it comes to ADHD. However, some of these side effects is lowering the blood pressure, sedation, weight gain, and dizziness. Again, just if this is some of the route on treatment for an ADHD, important to just keep an eye on those symptoms. So moving over, next slide is the consideration for parents. It is very, very crucial as parents to educate and understand what ADHD is. It's important to be supportive, communicate, and establish routine for our children. That way it can be easier for them to get into that transition when it comes into routine. It's very important for them to have a routine. Use positive reinforcement and collaborate with teachers. At times it can be a bit overwhelming, I believe, as a parent, but it is very important to always just stay positive, be supportive towards the children, be patient and understanding, know that this isn't purposely, a behavior of them being hyper, that it's on purpose. It's mostly this is the way their brain is and the chemicals in the brain. Consideration for educators. I think this is very important, especially because a lot of these children with ADHD are now in classrooms, and at times it can be a little difficult to set a routine for them. However, it is important to just understand that ADHD presents differently in every child. That one student can be one way doesn't mean that the other student with ADHD would be the same, or every child is different. Just recognize that ADHD does present with challenges in areas like organization, time management, and informative processing. Therefore, some classroom strategies can always help out by providing accommodation to students or allowing them extended time on assignments or tests. Be graceful when it comes to alternative seating. Anything that we can help in the classroom um, setting for the student to thrive. Communication is super important, communicating with other teachers or with parents so that together they can create a plan which can help the child's learning process, maintaining regular communication with the parents, sharing what they observe, if any changes, again, with medication, if there's any change in medication, it's important for parents to communicate that with the educator, and educator as well to communicate and report if they noticed any changes in classroom in case, of course, of any medication change or just any changes in general. This here, it's the site that I use. They had great information out there when it came to ADHD. So this is my site source. I appreciate your time. Once again, my name is Nubia Serino. This is for Psychology 4322 Cognitive Psychology. Thank you.